There is a mistake that millions of seniors are making with their Medicare card right now, today, that is quietly costing them thousands of dollars. And the worst part is that almost nobody catches it until they are already standing at a pharmacy counter or sitting in a doctor's office being told their claim was denied. This is not a scam. Nobody is trying to steal your information. This is something far more frustrating because it is a mistake the system itself allows you to make, and Medicare will not call you to warn you about it. Your pharmacy will not explain it. Your doctor's office often does not even know the full details themselves. Today, I am going to tell you exactly what this mistake is, exactly who is most likely to make it, and exactly how to check right now whether it is already costing you money. Stay with me through this entire video because the fix takes less than 10 minutes, but the cost of not knowing about it can run into the thousands of dollars over just a single year. My name is Dr. Diane Marshall. I spent over 2 decades working inside the federal legal system. I have seen what happens when people trust that a government system will automatically protect their best interests, only to discover years later that a simple administrative detail costs them an enormous amount of money. That is exactly what is happening with this Medicare mistake right now. Before we go further, subscribe right now to Alert Americans and turn on notifications. Every week, I bring you the information that protects your money, your rights, and your future in plain English. Hit that subscribe button now. Let me explain exactly what this mistake is. The mistake involves something called Medicare enrollment periods, and specifically, the difference between enrolling at the right time versus enrolling late, or enrolling in the wrong part of Medicare for your specific situation. Most seniors assume that once they turn 65, they simply sign up for Medicare, get their card, and everything is handled correctly from that point forward. That assumption is where the expensive mistake begins. Medicare is not one single program. It has multiple parts, each with its own enrollment rules, its own deadlines, and its own penalties for getting the timing wrong. And here's the part that costs people the most money. Several of these penalties are not one-time fees. They are permanent. They attach to your monthly premium for the rest of your life, every single month, forever. Let me walk through exactly how this happens. The first situation, late enrollment penalty for Part B. Medicare Part B covers your doctor visits and outpatient care. Most people are automatically enrolled in Part B when they turn 65 if they are already receiving Social Security benefits. But if you are not yet receiving Social Security at 65, you have to actively enroll yourself, and there is a specific window to do it. If you miss that window and you do not have other qualifying health coverage, such as coverage through an employer where you or your spouse is still actively working, you face a late enrollment penalty. That penalty is 10% of the standard Part B premium for every full 12-month period you were eligible but did not enroll. And here is the part that destroys people financially. This penalty does not expire. It does not go away after a few years. You pay it every single month for as long as you have Medicare Part B, which for most people means for the rest of their life. Let me put real numbers on this. If you delay enrollment by 3 years past your initial eligibility, you could be looking at a 30% permanent increase to your monthly Part B premium. Over a 20-year retirement, that single delay can cost a senior well over $10,000 in unnecessary premium payments. $10,000 for a mistake that could have been avoided with a single form filed on time. The second situation, the Part D prescription drug penalty.com. This one catches even more people off guard because it specifically targets people who think they are being financially responsible by not signing up for something they believe they do not need yet. If you do not enroll in a Medicare Part D prescription drug plan or a Medicare Advantage plan that includes drug coverage when you first become eligible, and you go 63 days or more without what Medicare calls creditable prescription drug coverage, you face a late enrollment penalty for Part D as well. .com. This penalty is calculated based on how many months you went without coverage, multiplied by a national base beneficiary premium amount, and just like the Part B penalty, it is permanent. It gets added to your Part D premium for as long as you have Medicare prescription drug coverage, for the rest of your life. Many seniors who are healthy at 65 and not currently taking medications assume they can skip drug coverage until they actually need it. They believe they are saving money by not paying a premium for coverage they are not using yet. What they do not realize is that this decision can cost them dramatically more later, because once they do need prescription coverage, perhaps after a new diagnosis at 70 or 75, that permanent penalty is now attached to every single month of coverage for the rest of their life. The third situation, and this is the one that surprises people the most, choosing the wrong type of Medicare coverage for your specific situation and not knowing you can switch. Many people enroll in Original Medicare or alternatively in a Medicare Advantage plan during their initial enrollment window without fully understanding the long-term implications of that choice. They make a reasonable decision based on the information they had at the time, and then years later discover that decision is now costing them significantly more than it should, or is preventing them from getting coverage they actually need. Here is a specific and very common version of this mistake. Someone enrolls in Original Medicare and decides not to purchase a Medigap supplemental policy because their initial out-of-pocket costs seem manageable. Years later, after developing a health condition, they want to purchase a Medigap policy to help cover their increasing out-of-pocket costs, only to discover that in most states, insurance companies are allowed to charge them dramatically higher premiums or even deny coverage entirely because they missed their guaranteed issue window, which in most cases is only the 6-month period immediately following their Part B enrollment. This means the decision you make in your first 6 months on Medicare can permanently affect your ability to get supplemental coverage at a fair price for the rest of your life. Most people are never told this clearly when they first enroll. Now let me tell you about Harold. Harold is 68 years old and lives in North Carolina. He retired at 63 from a manufacturing job and continued working part-time for a small business that did not offer health insurance. He assumed, like many people do, that since he was not yet 65, Medicare simply was not relevant to him yet, and he would deal with it when the time came. When Harold turned 65, he was busy. His wife was managing a health issue, his part-time work picked up seasonally, and signing up for Medicare felt like something he could handle in the coming months. Coming months turned into 2 years. When Harold finally enrolled in Medicare Part B at 67, he was informed that because he had gone 2 full years past his initial eligibility window without qualifying coverage, he would face a permanent 20% late enrollment penalty added to his Part B premium. Every single month, for the rest of his life. Harold also had not enrolled in Part D prescription drug coverage during that time, since he rarely needed prescriptions and his part-time job had offered a basic discount card he assumed was sufficient. When he eventually enrolled in Part D, he discovered an additional permanent penalty attached to that premium as well, because the discount card did not meet Medicare's definition of creditable coverage. Combined, these 2 permanent penalties are costing Harold over $80 extra every single month for the rest of his life. Over a 15 to 20-year retirement, that single oversight will cost Harold somewhere between $14,000 and $19,000. Harold did not do anything reckless. He did not ignore official mail or refuse to engage with the system. He simply did not know the specific deadlines applied to his situation, Because nobody clearly explained it to him in a way that connected to his exact circumstances. Harold's story plays out across America every single day, in slightly different versions, for hundreds of thousands of seniors dot the building. Now, let me give you the action plan to check whether this mistake is already affecting you or to prevent it from happening if you have not yet enrolled. Step 1. If you are already on Medicare, check your premium statement for a penalty notation. Your Medicare premium statement or your Social Security benefit statement, if your premium is deducted automatically, will show your current Part B and Part D premium amounts. Compare these to the standard published premium amounts for the current year, which you can find directly on Medicare.gov. If your premium is higher than the standard amount and you are not sure why, that difference is very likely a late enrollment penalty. Step 2. If you discover you are paying a penalty, call Medicare directly to confirm the reason and the calculation. The number is 1-800-MEDICARE. Ask them specifically to explain any penalty being applied to your premium, how it was calculated, and whether you have any grounds for what is called an appeal or a reconsideration, particularly if you believe you had qualifying coverage during the period in question that was not properly documented. Step 3. If you are approaching 65 and not yet enrolled, mark your specific enrollment window immediately. Your initial enrollment period is a 7-month window. It begins 3 months before the month you turn 65, includes your birthday month, and extends 3 months after. If you are still working and covered by a qualifying employer health plan, different rules apply through what is called a special enrollment period, and you need to understand exactly how that applies to your specific employment situation before assuming you are automatically protected. Step 4. If you are choosing between Original Medicare and Medicare Advantage, understand the guaranteed issue window for Medigap before you decide. If there is any chance you might want a Medigap supplemental policy in the future, strongly consider your options within the first 6 months after your Part B enrollment, while you have guaranteed access regardless of your health condition. Waiting can permanently limit or eliminate this option. Step 5. Use the free Medicare counseling service in your state. Every state has a program called SHIP, the State Health Insurance Assistance Program, which provides completely free, unbiased counseling about your specific Medicare situation. This is not affiliated with any insurance company trying to sell you a product. You can find your state's SHIP program directly through Medicare.gov, and a single conversation with a counselor can identify mistakes or opportunities specific to your circumstances that would take hours of independent research to uncover on your own. Before I close, let me address 3 myths about Medicare enrollment that are causing people to make this exact mistake right now. Myth 1. I do not need to worry about Medicare until I actually retire. This is false for many people. If you are not actively working for an employer that provides qualifying group health coverage, your Medicare enrollment clock starts at 65, regardless of whether you consider yourself retired. Myth 2. I am healthy, so I do not need prescription drug coverage yet. This is exactly the thinking that creates permanent Part D penalties. The decision is not really about whether you need medication today. It is about avoiding a penalty that will follow every premium payment you make for the rest of your life, regardless of your future health. Myth 3. I can switch my Medicare coverage anytime without consequences. This is only partially true. While there are annual enrollment periods that allow certain changes, your ability to add certain supplemental coverage, particularly Medigap policies, without medical underwriting is often limited to very specific windows that, once missed, may never reopen on the same favorable terms. Let me bring everything together. Medicare enrollment timing is not a minor administrative detail. It is one of the most financially consequential decisions many seniors will ever make. And the penalties for getting it wrong are not temporary inconveniences. They are permanent additions to your monthly costs that can follow you for the rest of your life and total tens of thousands of dollars over a typical retirement. The system will not stop you from making this mistake. Medicare will not call to check whether your enrollment timing matches your specific situation. The responsibility to understand these deadlines and protect yourself from these penalties belongs entirely to you and to the people in your life who care about you. Now you know exactly what to check and exactly who to call if you find a problem. If this video gave you something valuable, hit the like button right now and share it with someone in your life who is approaching 65 or who already has Medicare and has never specifically checked their premium against the standard published amount. That single conversation could put thousands of dollars back into their retirement. Subscribe to Alert Americans because every week we bring you exactly this: the information that protects your money, your rights, and your future before it costs you anything at all. Stay protected. I will see you in the next one.